Thank you very much, Julia. Greetings, colleagues. All right, my name is Fungai Kavenga, as introduced. I'll take you through our experiences in targeted screening for active TB in Zimbabwe and our plans for rolling out digital X-ray platforms as well as CAD platforms. Next slide, please. So TB, is we're all aware, is the second leading cause of mortality from a single infectious agent worldwide. TB continues to be a public health problem in Zimbabwe. We're on the global watch list for TB, and we're on the global list of 30 high-burden countries for general TB and TB HIV. And we know that most of our missed cases are amongst hard-to-reach populations and hard-to-reach groups. And this was informed by our TB prevalence survey of 2014. So as a country, we know that there is need for interventions to detect these missed cases to combat the spread of TB, as well as accelerates progress towards our national and global targets. Next slide, please. So the country is implementing targeted screening for active TB. We call it TaS4TB in short. So basically, this is intensified case finding among high-risk groups using mobile X-ray trucks that are equipped with a laboratory. So this intervention offers free TB screening, HIV testing, diabetes screening. We also offer hypertension screening, as well as TB COVID-19 bidirectional screening. So we reach out to our communities to raise demand for this intervention, and we hold at least one screening activity per province per month. So we go from district to district within each province with this track and targeting the hard-to-reach populations, the high-risk groups. Next slide, please. So our current plan in terms of this intervention is to transition. In the past, this intervention was being implemented through a partner. So now we are transitioning this intervention to subnational level so that provinces can implement this on their own. And I can confirm that we've achieved transitioning from implementing partner to provinces. And this transition was supported by the Global Fund. So this implementing partner, that is the Union Zimbabwe Trust, they have the technical expertise. So we made use of that expertise to train our provincial teams before we handed over X-ray trucks to them. So we conducted training in all 10 provinces for March 2022. Next slide, please. So we have distributed at least one truck per province, and each province now has a highly trained and skilled provincial team that is supported by the district teams to implement this intervention. So in each district, a local team comprising of nurses, community health workers, local leaders, they join in when the trucks visit the areas. So these trucks have an X-ray machine and a laboratory equipped with gene expert machine. So we use electric power to charge the power units. We also have solar backup as well as a backup generator if there's need. Next slide, please. So to date, that is from March 2022 to November 2022, we've managed to reach slightly above 15,000 high-risk communities. About 14,000 chest X-rays have been taken, 252 TB cases diagnosed, and 72 new infections of HIV were picked up from about 3,190 people tested for HIV. Next slide, please. So as a country, I think we've learned some lessons from this decentralization exercise. Firstly, there's need for a pilot to clear any operational issues. Capacity building is key so that the subnational levels on the intervention, and it also ensures that they take good care of the equipment and the assets that come with this intervention. Then we also learned that there's need for an in-country service partner to maintain and repair this equipment. And lastly, the chest X-ray is an important tool. I'm sure we've heard from the previous presenters that the X-ray is pivotal in us ending TB as a global epidemic. It is a highly sensitive tool, and as a country, we've proved that its utility among hard to reach and high risk groups. Next slide, please. So this is just implementation in pictures. I think this was in one of the districts at a farming compound. I think you can see the teams there attending to the communities. Next slide, please. So this is just on your right. I think that's just a workstation where we have a client being offered services. I think this is a registration desk. Then on your left, I think that's the doctor there. On the right, trying to interpret an X-ray for a client. Next slide, please. Then in terms of access to radiology, I think we have a plan as a country. Next slide, please. So I'll just give you a context of our health facilities in the country. We have 65 districts in the country and a total of 1,650 health facilities. 4 of these facilities are central hospitals and 8 are provincial hospitals. So our central hospitals, those are quaternary institutions. Then we have our tertiary institutions as the provincial hospitals. Then secondary level, those are district hospitals. Next slide. So the target is to have at least one functional digital X-ray machine in each district hospital and one functional machine in each mission hospital. The ideal would be to have a functional machine in each institution, in each health institution. So that would be about 1,646 machines in total. So an assessment that was done into available X-ray machines, I think we have 36 that are available versus the ideal, shows that there's need to have innovative solutions to ensure universal access to radiological services. Next slide, please. So as of May 2021, we had 57 working X-ray machines. 36 of those are digital X-ray machines. So that means we have a gap of 80. We have a minimum gap of 80 X-ray machines that need to be installed in the cards software. So at the moment, no X-ray machine in the country is CAD software. Next slide, please. So this is just showing the requirements in terms of digital X-ray machines disaggregated by province. So this is informed by the number of facilities in the needs. So as you can see, but it's not uniform across the provinces. Next slide, please. So we have come up with plans to bridge the gap. Next slide, please. Okay, so we need a total of 8 static digital X-ray machines, and these will be distributed by facility. We have a breakdown of which is available on that link, and priority of distribution of these digital X-ray machines will be given to high volume sites as per our TB distribution of our TB burden. Next slide, please. Then in terms of portable X-rays, the plan is each central and provincial hospital should have at least one portable X-ray machine. Then in each district, we require at least one portable machine. That is if we manage to address the shortage of static machines. So in the meantime, we procured 14 portable X-ray machines, and we have plans to do a pilot in 3 provinces, 1 rural province and 2 urban provinces, so that we identify any challenges and best approach to use. So beyond the pilot, we will need a minimum of 40 portable X-ray machines, which will be distributed during the scale-up, and these will be distributed to high-risk and hard-to-reach sites for both facility and community-based screening. So these portable X-ray machines will be stationed at high-volume facilities, as well as go down deep into the communities for screening. Next slide. So this is just the proposed distribution of the portable X-ray machine disaggregated by province. Again, like I highlighted, distribution depends on the needs and the burden of disease. So as you can see, we as a country, we have a higher burden in our Midlands and Southern provinces, and they're also earmarked to receive more support in terms of this technology. Next slide, please. So as we are planning to do the pilots, we've done a checklist of things that we need to put in place before we implement the pilot of the portable X-ray machines. First thing is capacity building for the X-ray operators, the managers in the provinces, and technicians. We need a weekly reporting platform so that we'll be able to track the data and make timely decisions. There is need for after-sales technical support so that we don't face any glitches. Then, of course, we'll plan for an evaluation meeting after 3 months. And this evaluation meeting will inform scale-up of this intervention. Next slide, please. So in terms of the scale-up, we brainstormed what we may need to put in place. So obviously, I highlighted we need about 40 machines. There's need of capacity building, and of course, we will be armed with the evaluation baseline, and of course, the after-sales technical support will also be needed. Next slide. All right, I think I've come to the end of my presentation. So on your screens, the technology we acquired from Delft imaging, and I can confirm these trucks are on the road and serving our underserved communities. Thank you very much. Back to you, Madam Chair.